Hi, guys, and welcome to my presentation on the Comprehensive Drug Abuse Prevention and Controlled Substance Act of 1970. Hi, guys, and welcome to Let's talk about the overview of the Controlled Substance Act of 1970. It was a federal law that existed for decades regarding the classification and regulations of drugs in the U.S. Even though the Controlled Substance Act is not a bill itself, it was passed as a law by Congress as a Title II of the Comprehensive Drug Abuse Prevention and Control Act. Under this law, drugs are arranged into different schedules according to their potential risk, eligibility for medical usage, and potential for abuse. This was created during a time where the U.S. was experiencing an epidemic of drug usage and addiction in the late 1960s, which raised issues with the general population's health and led to disruptive changes in the society. Let's talk about the overview of the Here I created a little map of the different drugs and the different schedules. There is a need for a revision of the Controlled Substance Act in relation to the classification of marijuana as a Schedule I drug. Schedule I drugs are defined as substances considered to have high potential for abuse, no accepted medical use, and a lack of accepted safety under medical provision. As you can see, the drugs included in that schedule are heroin, LSD, and ecstasy and things like that. All drugs are examples of highly addictive drugs that can cause hallucinations or even be deadly. Schedule I drugs under federal law are illegal to own, sell, distribute, or create and can result in serious penalties and jail time. Here I create I created this schedule map to kind of share the different definitions of the different drugs in those schedules. Marijuana is classified in Schedule 1 that says has no current accepted medical use in the U.S., a lack of accepted safety for use under medical supervision, and a high potential for abuse. Historically, marijuana-related convictions and arrests has had unjust turn of events for demographic groups such as minorities, primarily African Americans and Hispanics, have the highest rates of convictions and arrests on charges related to marijuana. So it creates this kind of racial gap and kind of, unfair police practice and systemic injustices in the criminal justice system with linked to these arrests because of the marijuana related convictions. So this is another reason why I thought that it was important that we revisit the scheduling of marijuana, and as we go along in this PowerPoint, we'll understand why. I created Talk about the relevance in today's society. As of June 2021, medical marijuana is legal in 37 states, and it is legal for recreational use in 18 states, including DC. Despite this growing acceptance and recognition of marijuana's potential benefits, it still remains classified as a Schedule 1 drug at the federal level. I put this map here for us to kind of visualize all the legalizations and how it is creating this inconsistency between states regarding it being legal or it being illegal, and it kind of hinders the medical research on marijuana by imposing these strict laws. Conducting thorough studies on marijuana's therapeutic effects, dosage, recommendation, and advantages is just challenging due to the complicated and prolonged process researchers must go through to obtain federal approval to even conduct research on marijuana. I feel like just kind of closing that gap and just allowing us to understand if it actually has medicinal benefits or therapeutic effects for patients. This would be great to change and revise that policy so we can actually know what we're dealing with. Talk about Let's talk about the benefits to the public and consumers. If we revise this scheduling of marijuana in the Controlled Substance Act, we can see a large increase of tax revenue, creating jobs, creating employment, and increasing economic growth. Another thing we can see is reducing the burden on the criminal justice system and redirecting law enforcement to resources of more serious crimes. The potential mental health benefits that, such as anxiety, depression, things like that. Also, marijuana has potential therapeutic effects. During cancer treatment, it helps increase appetite and lower discomfort. Also, dealing with patients with glaucoma, it is known to decrease the intraocular pressure, which could also lead to treating glaucoma. Also, with patients with HIV and AIDS, marijuana has some evidence of increasing the overall quality of life for the related symptoms such as neuropathic pain, weight loss, and lack of appetite. I think it's really important to understand the benefits, and if we are able to change the scheduling of marijuana, we'll be able to let scientists research it more and see what else marijuana could be therapeutic for in today's society. This is just some more medical benefits of the legalization of marijuana and how marijuana helps these patients. I mean, nowadays you see a CBD smoke shop at every corner. So there's different forms of marijuana that are legal in every state, and THC and all those different products. I had a patient who actually moved from California who really struggled with her cancer, and when she was in California, she had a prescription to marijuana, and she saw very good results in her pain levels. When she moved to Texas, she couldn't find a provider who would give her that same prescription, so she was looking for alternative treatments, but none of them worked as well as her prescription of medicinal marijuana when she was in California. So that's just something to think about. This is talk about some of the challenges. The criminalization of marijuana may limit economic opportunities for advancement for people who have previously encountered these issues on their public record. Teens and adolescents are being targeted and prosecuted for marijuana offenses, especially those in their late teens and early 20s. At an early age, their ability to seek higher education, likelihood of finding employment, and direction of a life could be negatively impacted because of a prior offense. And people who are getting these marijuana offenses may be subject to harsh punishments or long sentences. It is a known fact that Black and Hispanics are 3 times more likelier to get sentenced for marijuana offenses compared to their white counterparts. The racial disparity in enforcement is a concerning issue, often attributed to biased policy, practice, and systemic inequalities. It is also known that communities with lower incomes usually suffer unfairly from marijuana laws. These populations often lack access to the resources necessary to effectively navigate the legal system, which leads to increasing rates of arrest and jail time. Just looking at some of the pros and cons of legalizing marijuana. Some of the pros include like economic stability, innovation for new products and services, criminal justice reform, and revenue boosts. Some of the cons include health risk. Excessive or prolonged use of marijuana can lead to mental health issues, impaired cognitive function, and respiratory problems, addictive natures, altered perceptions. Marijuana has been known to be called the gateway drug, opening up adolescents and individuals to harsher drugs. Legalizing the drug can lead to substance abuse, impaired driving, memory issues, and just the workplace safety and productivity. Enforcing workplace policies related to cannabis use can present challenges. So, with every policy, there are going to be some pros and some cons. Just look. So yeah, my position as it stands is I do agree for the revision of the Schedule 1 marijuana classification. And these reasons are for the health benefits. I feel like everyone should have access to this drug if it indeed shows medicinal purposes. And I feel like it should be changed so that scientists do have the research that they need to decide if it does hold therapeutic benefits. Also, for social justice for minorities, in the slide before this one, you saw how 3.73% of African Americans and Hispanics are 3 times more likely to be in jail over these marijuana offenses, and they receive sentences as long as 30 years over simple possession or drug charges. And it just doesn't really seem fair of having the same life sentence as someone who murdered someone. It doesn't make sense. And also for tax growth revenue, who doesn't want new schools and new buildings and, less stress on taxpayers when we can get this money from something that is going to be a leisure or something that's actually going to be medically beneficial? Like all the other states are doing it. Not to say, we have to, but at least let it be an option. And if this is going to be used, it definitely should be under medical supervision. As a nurse, I see patients suffering from different medical conditions all the time. I agree that if the law is revised, a physician should be able to prescribe cannabis if it is truly beneficial to the patient's condition. I also think that if a patient is to take this substance, it should be in a controlled environment with a healthcare professional as a treatment. If whether it's legal or illegal, it is the nurse's responsibility to address the code of ethics, guidelines of education and prevention. Nurses ensure patient safety by educating patients on substance abuse. To top it all off, just to give a biblical perspective, Christians are called to show love and compassion to others. Some individuals may view the potential health benefits of marijuana as a means to alleviate suffering and promote well-being. And I feel like that does align with the compassion and care that we are called to have. If I see a patient that's suffering from cancer and their doctor prescribes them medicinal marijuana, if that's going to help them improve their overall quality of life, then I agree to that. I don't want to see my patients suffering, but just like how I said before, all this has to be under medical supervision, so we can make sure that people aren't abusing this drug and they're using it for the right reasons. And our bodies are important, so the Lord calls them the temple of God. We have to start by eating right, eating healthy, exercising, and taking good care of them, because the Lord knows that we can be happier and better people if we are healthy. So it starts from home, it starts with the basics, so that you can even prevent having to depend or rely on alternative treatments. But if you do, you do. As long as it is safe, and as long as nurses, we promote safe and evidence-based practice care, this overall will improve the health of our patients. But just to end it all off, I do agree that if we revise this scheduling of marijuana, it could open up a lot of doors to medical research, and we can understand the therapeutic benefits of the drug. Thank you, everybody. Bye-bye. And to top